Interesting TCM and acupuncture. The 12 regular meridians, 8 extraordinary meridians, and their use in clinical application. The lesser yang triple burner meridian of the hand, the lesser yang gallbladder meridian of the foot, the terminal yin liver meridian of the foot. Contents. 10. The lesser yang triple burner meridian of the foot. 11. The lesser yang gallbladder meridian of the foot. 12. The terminal yin liver meridian of the foot. 10. The lesser yang triple burner meridian of the hand. 1. Name, circulation, illness, acupoints, and treatments. The hands and feet, yin and yang, and the organs and viscera make up the name of the meridian. The lesser yang triple burner meridian of the hand runs next to the terminal yin pericardium meridian of the ring finger. It passes along the arm center past the shoulder and nape and face. It meets the lesser yang gallbladder meridian at the outer canthus. It belongs to the lesser yang and connects internally to the triple burner. It serves as the external to the internal pericardium. It has much qi and less blood. 2. The lesser yang triple burner meridian of the hand circulation. The spiritual pivot meridians and vessels chapter, Meridian and Vessel Circulation original text says, the lesser yang triple burner meridian arises from the fingertip of the index finger and next to the little finger. It rises between the two fingers and circulates on the dorsal surface of the hand. Then it passes the forearm between the ulna and radius. It travels up and penetrates the elbow. It circulates along the outer aspect of the upper arm and rises to the shoulder. Then it meets with the lesser yang foot meridian and enters the chui pen. It separates down to the tanzhong, scattering in the pericardium, then entering the diaphragm. It circulates in the triple burner. It has a branch which exits the chui pen, rises up the nape, then it travels to the ear and moves directly upward. It leaves the ear and passes the cheeks. It has a branch which enters the ear center and rises up to the front of the ear, passes the cheek, and ends at the corner of the eye. Explanation of the above text. The meridian rises from the tip of the outer edge of the ring finger at the guanchong point. It rises between the fourth and fifth finger, travels up the back of the hand, passing the wrist at the yangchi point. It follows up the space between the ulna and radius, connecting to the tip of the elbow. Then it follows to the back of the upper arm, arriving at the shoulder. Then, on the dazhui point of the du meridian, it follows the course of the lesser yang gallbladder meridian and enters the chui pen, the area between the clavicle and scapula. It separates and enters the tanzhong point in the chest center, between the two pectoral muscles. Its vessel qi scatters and connects to the pericardium. Then it penetrates the diaphragm, connecting to the three burners. It has a branch which leaves the tanzhong point and rises from the area above the clavicles. Then it travels up the neck and arrives at the outside of the ears. Then it passes from the corner of the ears. Then it enters the face under the cheek and rises, ending at the outer canthus of the eye. It has a branch which leaves the area behind the ear, enters the ear center, and rises to the front of the ear. It passes the front of the cheek and arrives at the outer canthus at the Zanzhu Kong and Tongzi Lian acupoints. Its vessel meets with the lesser yang gallbladder meridian of the foot. 3. Lesser yang triple burner meridian of the hand illnesses. The spiritual pivot meridians and vessels chapter illness section says, when it moves in pathogenic change, the ears become deaf and the throat swells. There is throat obstruction. The illnesses of this meridian cause sweating, pain of the outer canthus, swelling of the cheeks, pain of the area behind the ears, shoulder, upper arm, elbow, and outer shoulder pain, and the inability to use the little finger. Explanation of the text. When the meridian becomes ill, it causes illnesses such as deafness, ringing ears, throat swelling, and pain. The meridian can be used to treat illnesses of qi, such as spontaneous sweating, outer canthus pain, swelling of the cheeks, pain of the back of the ears, shoulders, elbows, and outer shoulder, as well as inability to use the little finger. 4. The acupoints of the channel. There are 23 points in the meridian, with 13 on the arm and 10 on the head, nape, and shoulder. The first point is guanchong, and the last point is sijukong. The circulation of the channel is guanchong, yetmen, zhongzhu, yangchi, waiguan, zhigou, huizong, sanyangluo, sidu, tianjin, qingling, qinglingyuan, xiaoluo, naohui, jianliao, tianliao, tianyou, yifeng, jimai, luxi, jiaosun, armen, Arhuliao, and Sijukong. There are 8 special points, including 5 transfer points, which start with guanchong, which is the yang, jing, and metal point, which is followed then by yemen, zhongzhu, jigou, and tianjin. The yuan source point is yangchi. The collateral point and 8 meridians meeting point of the yang way is waiguan. The shi cleft point is huizong. 5. Treatment of the meridian. The circulation of the meridian and its illnesses. To treat the eyes, use sijukong, yemen, and guanchong. To treat the ears, use armen, yifeng, zhongzhu, waiguan, and yetmen. To treat the throat, use waiguan, yemen, and yangchi. To treat partial headache, use sijukong, jiaosun, waiguan, and tianjin. To treat febrile illness, use guanchong, zhongzhu, waiguan, and catch wind and connect the collaterals. It can treat the ears, mouth, teeth, and face. Zhigou can leak heat and improve defecation. Zhongzhu and yangqi can treat wasting disease. 11. Lesser yang gallbladder meridian of the foot. Name, circulation, illness, acupoints, and treatment. Naming convention. The hands and feet, yin and yang, and organs and viscera make up the name. The lesser yin gallbladder meridian of the foot begins at tongziliao and passes the side of the head, runs down the chest and thigh and outer aspect of the lower leg, passing the little toe and ending on the 4th toe. It belongs to lesser yang and is associated with the gallbladder. It connects to the liver and is the outer aspect of the inner terminal yin meridian. It has much qi and less blood. 2. Lesser yang gallbladder meridian of the foot circulation. The spiritual pivot meridians and vessel chapter circulation section says, the lesser yang gallbladder meridian of the foot rises from the outer canthus, travels to the corner of the forehead, passes down behind the ears, circulates to the neck, moves in front of the lesser yang meridian of the hand, passes the shoulder, connects to the lesser yang meridian of the hand and enters the chui pen. It has a branch which travels from behind the ear and enters into the ear, exits the front of the ear and travels to the outer canthus. It has a channel which leaves the canthus, follows down to the Da Ying point, connects to the hand lesser yang meridian, passes along the cheek to the Jiachu point, follows down the neck and harmonizes with the chui pen, enters the chest center, passes to the diaphragm connecting to the liver. It belongs to the gallbladder, passes along the sides, leaves the qi thoroughfare, passes the lower abdomen, and traverses the buttocks. It has a branch that enters the chui pen and passes the hypochondrial region. It passes the chest, running down to the sides. It descends to the bottom of the center and follows the biyang area. Then it exits the knee and lowers to the front of the shin bone. It travels directly to the juigu point, moving down to the outer ankle, traveling along the top of the foot, entering the little toe and the 4th toe. It has a branch which passes the instep, enters the large toe, passing the side of the big toe, entering its tip, and then passing the nail bed, passing the sanmao hair on top of the toe. Explanation of the above text. The circulation of the meridian arises from the outer canthus at the Tongziliao point, travels to the center of the forehead at the Heyan point, following downward outside the ears at the Wangu point, traveling back along the cheek to the eyebrows at the Yangbai point. Then it travels to the back of the head at the Fengshi point. It passes down the neck to the shoulder, then it meets with the Dajui point, entering the Chui pen. It has a branch which enters the ear center, passes down the front of the ear, arriving at the outer canthus. Another branch exits the outer canthus, followed downward to the Da Ying point, connects with the lesser yang meridian of the hand, and passes the cheek. Then it travels to the area under the eye socket, passes up to the area under the mandibular region, where it descends to the neck. Then it enters the Chui pen and passes down to the diaphragm, connects to the liver, belongs to the gallbladder, passes the sides, descends past the thoroughfare of qi, descending the pubic region and laterally passing the area of the buttocks and sacrum. Another branch passes directly down to the Chui pen, entering the axilla, passing the chest sides, entering the Huantiao point, and running down the outer leg, passing the exterior of the knee, running down the fibula and directly arriving at its end. It travels directly to the outer ankle, entering the back of the foot and traveling to the fourth toe tip at the Zuqiaoyin point. The meridian has another branch at the back of the foot, and it travels from the exterior big toe. It then returns to the exterior of the nail bed, running to the point where the hairs of the big toe are connecting to the terminal yin liver meridian. It connects to the gallbladder, liver, diaphragm, ears, eyes, and throat. 3. Lesser yang gallbladder meridian of the foot illnesses. The spiritual pivot meridians and vessels chapter, section on illnesses of the meridians, says, when it moves in pathogenicity, there's bitterness in the mouth, heavy breathing, heart side pain, inability to turn. When illness is deep, the face will be ashen and the body will not have any luster. The foot exterior will seem hot. This is an example of yang flaccidity. This meridian can treat illnesses of the bones, headache, chin pain, outer canthus pain, chui pen center swelling, axillary swelling, horse knife goiter, sweating, well, shaking and cold, malaria, pain of the chest sides, buttocks, knees, and exterior thigh, the Zhui Gu point, external ankle, and pain of the joints, as well as inability to use the little toe. Explanation of the text. When the meridian changes pathogenically, it results in the following illnesses: bitter in the mouth, sighing, chest side pain, inability to turn the body. Deep illness leads to a sullen and ashen complexion. The body seems to lose its brightness and luster. The lower leg exterior becomes hot. It can also cause the blood of the lesser yang meridian to reverse, causing flaccid cold, numbness, and soreness. The acupoints of this meridian mainly treat diseases that occur in the bone aspect, and it can be used to treat partial head headache, pain of the temple area, diseases of the outer canthi, pain of the chui pen, swelling pain, axillary swelling, goiter as if a sword is cutting, spontaneous sweating, trembling and cold, malaria, pain of the chest, sides, upper leg, knees, external leg, shin, external ankle, pain and pain of all the joints, inability to use the fourth toe. The lesser yang gallbladder meridian of the foot has 44 points on each side for a total of 88 points. There are 15 points on the lower leg, exterior, and 29 on the shoulders, chest, and head. The first point is Tongziliao, and the last point is Zuqiaoyin. The points are, in order, Tongziliao, Tinghui, Shangguan, Heyan, Xuanlu, Xuanli, Qubin, Lugu, Tianchong, Fubai, Touqiaoyin, Wangu, Benshan, Yangbai, Toulinqi, Erchuang, Zhengying, Chengling, Naokong, Fengchi, Jianjing, Yuanye, Zhejin, Riyue, Jingmen, Daimai, Wushu, Weidao, Zhuliao, Huantiao, Fengshi, 中毒、西洋关、阳明川、阳交、外求、光明、阳夫、选中、秀虚、竹林期、第五会、假西, and 注桥引. There are 10 special points. The 5 transfer points start with Qiao Yin, which is the Yang Jing and metal point. Then follows Jia Xi, Zulin Qi, Yang Fu, and Yang Ling Chuan. The Yuan source point is Qiu Xu. The collateral point is Guangming. The Xi cleft point is Wai Qiu on the gallbladder meridian. The Yangjiao is on the Yangwei meridian. The 8 meeting points is Yangling Chuan, and is the meeting point of the sinews, as well as Zhuigu, which is the meeting point of the marrow. The 8 meridians meeting point is Zulin Qi and meets with the Dai meridian. The lower He point is Yangling Chuan on the liver meridian. Treatment. It treats pain of the sides, liver, gallbladder illness, febrile illness, nervous system and head illness, eye, ear, nose, and throat illness, illnesses of the liver and gallbladder with chest and side pain, mouth bitterness, sighing, vomiting, lesser yang, febrile disorder, cold and hot coming and going, nervous system illnesses. The meridian circulation can treat partial headache, outer canthus pain, chin pain, eye pain, treipan swelling, flaccidity, knee swelling, chest, side, and thigh pain, and foot exterior heat. 12. Terminal yin liver meridian of the foot. Name, circulation, illness, acupoints, and treatment. Naming convention. The hands and feet, yin and yang, and the organs and viscera make up the names. The terminal yin liver meridian of the foot starts at the dadun point and passes along the back of the foot, lower leg, upper leg interior, 8 cun above the ankle. It passes the tai yin meridian and around the genitals and enters the lower abdomen. It connects to the liver, forming a collateral with the gallbladder, then entering the throat and connecting the eyes, passing the forehead and ascending to the crown, connecting to the du meridian. It has a branch which leaves the liver, penetrates the diaphragm, connects to the lungs. It belongs to terminal yin. Internally, it belongs to the liver. It connects to the gallbladder and acts as the internal aspect of the Shaoyang meridian. It has much blood and little qi. Terminal yin gallbladder meridian of the foot circulation. The Spiritual Pivot Meridians and Vessels chapter says, in its circulation section, it arises from the border of the hair of the large toe, passes up the inner foot, leaves the inner ankle 1 cun, passes the ankle 8 cun, and meets with the greater yin meridian, then passes the crease of the knee, runs up the inner thigh, enters the pubic region, passes the genitals, enters the lower abdomen, passes the stomach, enters the liver, connects to the gallbladder, penetrates the diaphragm, covers the sides, enters the throat, enters the forehead, connects to the eyes, ascends to the crown where it meets with the du meridian. It has a branch that leaves the eyes and passes to the jiache, wraps around the lips. It has a branch which leaves the liver and penetrates the diaphragm, rising to the lungs. Explanation of the above text. The terminal yin liver meridian of the foot rises from the large toe in the border of the hair at the dadun point. It rises along the top of the foot interior, passing the xingjian and taichong points. It passes 1 cun medial to the inner ankle at the zhongfeng point. It rises to the lower leg interior, passing the sanyinjiao, ligo, zhongdu, and xiguan points. It passes 8 cun above the inner ankle and meets with the tai yin spleen meridian of the foot. It passes the crease of the knee at chuchuan. It runs up the interior thigh at Yinbao, Zuwulin, and Inlian. Then it enters the pubic region, passing the genitals, arriving at the lower abdomen at the Jimai, Chongmen, Fushe, Chugu, Zhongji, and Guanyuan points. Just a correction, it runs up the interior thigh at Yinbao, Zuwuli, and Inlian points. It passes the sides of the stomach, entering the liver, connects to the gallbladder at the Jiangmen and Qimen points. It enters the diaphragm, spreads to the chest sides, connects to the throat, runs up to the top of the throat, enters the eyes, runs up to the forehead, passes to meet the du meridian at the crown. It has a branch which runs from the eyes to the cheeks. It circulates around the lips. It has a branch in the liver which leaves the liver and connects to the diaphragm, running up to the lungs and meeting at the greater yin lung meridian. It connects to the organs, to the liver, connects the gallbladder, meets the lung and stomach and kidney and brain. 3. Illnesses. The spiritual pivot meridians in Vessels chapter illness section says, when it moves in pathogenicity, the waist will be sore and unable to bend. Men will have a hernia, and women will experience abdominal swelling. If the illness is deep, the throat will be dry and the face will lose its color. The liver meridian may be used to treat chest fullness, vomiting, leaking, hernia, wasting away, and urine retention. Explanation. When the meridian becomes sick, it results in sore waist and the inability to bend. Men can experience hernia of the small intestine, and women can experience abdominal swelling. If it's serious, the throat will be dry and the face will lose its color, with no red from the blood entering the face. The meridian can be used to treat chest stuffiness, nausea and vomiting, diarrhea, small intestine hernia, bedwetting, and urinary retention. Acupoints. The meridian has 14 acupoints with 11 on the legs and 3 on the abdomen and chest. It rises from the Da Dun point and ends at the Qimen point. Its circulation in order is Da Dun, Xingjian, Tai Chong, Zhongfeng, Li Gou, Zhongdu, Xi Guan, Qu Quan, Yin Dao, Zu Wu Li, Yin Lian, Jimai, Zhangman, and Qimen. There are 9 special points. The 5 transfer points are Da Dun, which is the Yin Jing and the Wood point, followed by Xingjian, Taichong, and Zhongfeng and Chuchuan. The Yuan source point is Taichong, which is also the Shu stream point. The Lowell connecting point is Li Gou, and the Shi cleft point is Zhongdu. The 8 Hui meeting point is Zhangman. It is the meeting point of the organs. Treatment. The meridian can be used to treat liver and gallbladder illness, gynecological issues, genital illnesses, nervous system and eye illness. It can also treat waist pain, lower abdomen pain, hernia, retention, just menstruation, hiccup, headache with blurry eyes, lower limb obstruction illness. In clinical practice, it's principally used for waist pain with the inability to bend, chest distension and fullness, lower abdomen pain, hernia, pain on the vertex, throat dryness, glaucoma, bitter mouth, and emotional annoyance. Illness region discussion. The terminal yin liver meridian has a branch extracollaterals which meet with the greater yin and lesser yin meridians and connect to the area between the waist and the ankle. When the meridian qi is not functioning properly, it makes the waist sore and with the inability to bend. The terminal yin liver meridian of the foot passes the genitals and enters the lower abdomen. It covers the sides. If the liver is attacked by a pathogen, the meridian qi will not work properly and the chest and sides will become distended. The lower abdomen may become ill. If there's a hernia, the liver meridian runs up to the throat and meets the eyes. Its meridian qi, if maladjusted, can make the throat dry and the eyes cloudy. It passes to the vertex, and if the meridian qi is maladjusted, it may cause pain of the vertex. The liver dredges qi, so if it's not performing this function, it leads to liver qi stagnation. This can change to fire and lead to bitter mouth and feelings of easily being annoyed. Thanks for watching.